All right, well, ladies and gentlemen, good evening and welcome to the Mack Ballroom here at the Murphy Center at SMU. We're so grateful to SMU for hosting us in this event this evening. And we're incredibly grateful that you came out for this important discussion. We've got some friends that are stuck in traffic, so try not to give them a dirty eye when they walk in late tonight. But we are incredibly grateful that you're here for this important discussion. As we all know, and as our incredible panelists will talk about tonight, healthcare really is a mess across this country. But we're glad that we have partners like Congresswoman Beth Duyne and like Dr. Goodman of the Goodman Institute to work with us to drive meaningful policy reform that's going to help increase access and drive down cost and make it easier for more Texans and more Americans to have better access to health care. So we're so grateful to have you tonight. We have an incredible panel this evening. Just one quick housekeeping note. When you came in, you should have been given a question card. We'll have a time for Q&A at the end, but we know that there are 1,000 issues we could be talking about tonight, but tonight is focused on meaningful healthcare policy reform. So we ask that any of those questions you might have throughout the discussion, write those down. We'll collect those at the end, and we'll be able to ask that of the panel. So without further ado, Mack, I'm going to hand the floor over to you for tonight's discussion.
Well, thank you so much, James, and a big round of applause for James putting this together. He is our Dallas Engagement Director who's really organizing communities here. As Americans for Prosperity, we're a nonprofit, nonpartisan grassroots group. Our job is to marry the public policy and the grassroots together. So to have our Congresswoman here, Beth Duyne, to have our public policy expert, Dr. John Goodman here, this is where we have really deliberate discussions how we can offer solutions at the federal level. So I also want to say thank you to all of you being here tonight. I know it's a Thursday night, and we're discussing, I know there's even football on tonight, but we're discussing healthcare. That's not a fun thing to discuss. It's an intimate thing. It's an expensive thing. So thank you for being here. And then the Consulate General of El Salvador is here this evening as well, so I want to recognize him for being here. But as we know, healthcare, we can fix this. And having a Congresswoman who wants to lead, a mom and a leader in Congress, to have you here to talk about health savings accounts with us, other things that we can do in Washington, D.C., I've seen firsthand the cost of healthcare going up. Having 3 kids, I never knew how expensive it would be. Having sports injuries that catch up with you, how expensive that may be. But Americans know that things are expensive. We've got skyrocketing inflation. But Americans for Prosperity has done a lot of polling across the country, talking to people about what we call the personal option. Not a public option, not the one-size-fits-all Medicare for all that Bernie Sanders would want. We want to empower patients. We want to empower families that they can make better healthcare decisions. Individuals are empowered at the end of the day. And 3/4 of voters see us in a critical stage right now in the cost of our healthcare. And they want candidates and they want elected officials who have a plan to fix things. So Congresswoman, I want to jump right into it. Why are we discussing healthcare reform? Why are you working on that? Why does it matter to you?
When you mentioned that it was personal and it's an intimate thing, yeah. I mean, think about how many other people you're going to give that amount of access to your body, to your family, to your future. Not very many. And what we've seen over the last few years is it used to be, because let me set the record straight. I come from a medical family. My dad, my dad's dad, my dad's dad's dad, and 5 generations of OBGYNs. And then on my mom's side, my mom was an RN, my grandmother's an RN, my other grandmother's an RN, we come from the healthcare side. And it used to be where it was a discussion between a doctor and a patient, where those conversations had, your doctor that you had pretty much your whole life. They knew your health history. They relied on their medical expertise and their experience to be able to guide them. Where we have come is so far away from that. It is now government, bureaucrats and politicians with no healthcare experience, no medical background, now making the decisions for us. I recently had a roundtable, and we had doctors, we had healthcare providers there. And this doctor was in tears. She said, I've gone to medical school. I know my patients. I know my job. Doctors are no longer allowed to practice medicine. We follow protocol. She said, a monkey could do my job. We've lost that. And what we have seen is decreased access to quality care. We have seen increased cost, and we have just seen care decrease. Quality has gone down. So it is an emergency at this moment. It is a crisis that we have to take care of. And as much as I know it's been used in political campaigns, we're still not addressing it. We have seen one side of the aisle want to go after complete one-size-fits-all government care. And it's not care. And by the way, having health insurance is not the same thing as having health care. And those are differentiators that I think we really need to talk about and discuss. I know one of the reasons why it's personal to me is, look, I had a daughter who had 9 surgeries the first year she was born. I had to fight with my insurance company to get them to cover her care. Not only did I have to fight, I had to threaten to literally go into the CEO's office with my 4-month-old and bring cameras if he wouldn't meet with me and talk about it. We should never be brought to that point. But right now, you've got people who are deciding whether or not they're going to pay for their health bills or whether or not they're going to put food on their table. And as inflation has increased and costs of everyday items have increased, that is becoming more and more realistic, and it's growing. It's a growing problem. So we do need to attack it. We need to give people more options. We need to give people more control over their lives. We need to prioritize the doctor-patient relationship, and I understand that it's not one size fits all. People should be able to decide based on their needs, based on their priorities, and based on their budget what works best for them and how we can help facilitate that.
I love that, Congresswoman. Your zeal, your passion for it. There's leaders here in Texas. Texas can lead the way, and you're one of those, and we need that in D.C., and that's why we're having this event. But Dr. Goodman, I want to get to you. You've been an expert in this field. You've written many papers, worked on legislation. Why is healthcare so expensive?
Healthcare is expensive because of federal regulation. So Beth put her finger on 2 huge problems that I want to draw your attention to, and they should be big issues in this election. For millions of people, healthcare has simply become unaffordable. The premiums are out of sight, the deductibles are out of sight, and that is not a natural, normal thing in a normal marketplace. That is a result of bad government policy. So if you're a family of 4, and you do not get a subsidy from the federal government, and you take the average premium and add it to the average deductible, right now it's $25,000. That's the average nationwide. The family has to spend that much money before its health insurance kicks in. That's not affordable. And that's in the individual market, which is totally regulated by the federal government. But many employer plans for low-income employees and small businesses are almost that bad. And then Beth mentioned the issue of quality. What has happened is the networks that these plans are attached to have become more and more narrow. So even Blue Cross here in Dallas, even its plans are extremely narrow. And this may surprise all of you, but you cannot buy individual insurance in the Metroplex that will get you into UT Southwestern Medical Center, which is one of the premier medical institutions really in the whole world. You can't buy individual insurance in Texas that gets you into MD Anderson Cancer Center down in Houston. And this is happening all over the country. So 2 really bad things. Health insurance has become unaffordable unless you're getting a huge subsidy. And the quality of what you're buying is really bad. And let me just say one more thing about what the Democrats just did in Congress. Their solution to this problem is to spend a lot more money. And where does that money go? It doesn't go to you, it goes to insurance companies. And why is that? Because if they gave it to you, you wouldn't buy the plans that are out there in the market. Would you would you buy insurance with your own money? No, you'd go do something else. And so their answer is great for insurance companies, bad for you.
You know, as we talk about the cost of things, federal regulation, we've talked about inflation. Let's go back to Obamacare. It's over 10 years ago now, but we know premiums went up. People lost their insurance. They lost the doctor they wanted. My own wife had her premiums double and was dropped from her insurance in a given 1-month period. Then we had to pay tax penalties for that. So looking at that, those were a lot of surface level things people saw. What was happening under the surface? We were talking at lunch one time. This hurt even poor people by introducing Obamacare and more federal regulations. Dr. Goodman.
Oh, okay. Well, some of you may remember when Obama was running for president, they first said, well, we weren't going to insure the uninsured. And then Chuck Schumer pointed out, well, uninsured people don't really vote. 95% of all the people who vote have insurance. So then they changed the rhetoric and they focused on pre-existing conditions. And they said, you know, that if you have pre-existing conditions, you can be denied insurance and denied care. It turns out that if you have a chronic illness and you have to leave work and go to the individual market in Dallas, Texas, you were better off way back then than you are now. Because way back then, if you were denied insurance, you could go to the Texas risk pool. What was that? It was a standard Blue Cross plan. You could see any doctor, any hospital just about in the Metroplex. It cost a bit more, but you had access to the doctors you need. And today you don't. So things got worse, not better, if you have a healthcare problem.
Thank you, Dr. Goodman. Congresswoman, we know Obamacare is the law of the land, but how can we sidestep this? Can we just ignore it and provide people across the country just other options?
Well, I mean, I think Republicans actually tried to kick something across the goal several years ago. As you know, by one vote, it lost. Part of the problem is you can't just repeal something that so many people are reliant on now. Once you start a government program and you start getting people signed up for it, you can't just pull the rug out. What you can do is, one, take away the mandate, which is what they actually were able to accomplish in Congress, so not everybody has to be on that. But two, offer up other options. Again, offer up things that people can personalize to their own needs, to their own pocketbooks. It doesn't have to be Obamacare. But in Congress, everybody has this idea that people in Congress have phenomenal benefits. Do you all know that we are actually on Obamacare? So as congressional members, that was, I don't remember when that went into effect, but that we are required to be on the Affordable Health Care Act. And our coverage is terrible. And to your point, Dr. Goodman, when Obama came in and he created that system, 85% of people were already covered somehow for healthcare costs, or were already on some type of plan, and were happy with it. Why they had to come in and affect 100% for the needs of 15% was beyond most people's understanding. It made no sense. And again, what we've seen is decreased access, decreased quality, and increased price. What you can do as far as policy is offer up as many options, allow competition to reign, allow people to be able to pick and choose what they want, and set the free market on fire. One size fits all is ridiculous. I am not a man. I'm not worried about prostate cancer. I am in my 50s. I'm not worried about being pregnant again. So why am I having to cover those costs? I shouldn't have to. My kids are out. They've got their own insurance now. Why am I still having to pay for pediatric visits? We should be able to pick and choose, allowing the money that you make to be able to be spent on healthcare costs, for example, and I don't know if you want to get into HSAs yet.
Let's do it.
But on health savings accounts is one way to be able to do that. So your pre-tax dollars, allowing you more power and more control over how you spend that, is one way to be able to do that. I've got 3 bills that I've introduced. We can get into the specifics later on, but that would give you more access and more opportunities, more options. I think also recognizing that we can incentivize the private sector side. So the majority of people are on some type of employees provided insurance. If we can incentivize them to even allow you more power, when you're 24, you may not be thinking about insurance as being the benefit that you need, but when you're in your 30s and you've got, kids at home and they rely on it, you may pick and choose a job based on benefits. We need to make it as easy as possible for companies to be able to provide those benefits to their employees rather than insurance companies and the government.
Wholeheartedly agree. And part of the personal option is lowering costs. So expanding HSAs. As I've talked to Texans, they want more power to plan and pay for their healthcare services. So tell us about these bills. You've got a few, and a lot of people I found don't know what an HSA is. So if we can kind of explain that. So I need to be sold on it. I want to leave my private insurance, but I've been kind of on the fence.
So a health savings account, basically what you do is you set up an amount at the beginning of the year about how much you're going to put away out of your paycheck, and then you can pay, without taxes being taken out, you can pay off your healthcare costs. Right now, it's limited, $2,500 a year? So we're trying to actually expand how much that would be. And there's very few people who actually can create an HSA because it's usually on the high deductible amounts. Now, there are employment plans that can do this, but they could do matching as well. So we've got 3 bills. One that would allow the expansion, so you don't have a limit to how much you can put away. We're increasing that amount. But 2 that would give you more flexibility in how you spend it. One of the age groups that is problematic right now and most often finds themselves out of coverage is the group between 40 and 65. So it could be people who have a spouse who dies and they were on their insurance and now they found themselves without any insurance. It could be someone who gets divorced and they don't have insurance now because they were reliant on their former spouse. Or it can be people who've lost a job and now they don't have their employee-sponsored job. So allowing those people to get on their adult children's insurance is one way to go. And allowing HSA dollars to be able to be spent on them as well as their dependent kids. Another one that we've got is for parents, similar to what we do for college costs, to be able to put together a health savings account for their children that can create value by the time that they're 18, that instead of having to get in debt early on over healthcare bills, you now have a pot that you can actually use to be able to pay those off, again, pre-tax. Now, you got some people in Congress that don't like that, right? Because if they're not collecting taxes, they look at this as lost revenue. It's not lost revenue. It's allowing people to be able to use their dollars to pay for something that right now the government is paying multiple amounts for. Let the private sector work on it and allow people those individual options.
Agree there, because they're subsidizing things. Let people make better healthcare decisions for themselves, because we have a happier, healthier American population, and we don't have to have all these government programs. So, Dr. Goodman, you're the father of HSAs. So why did you even work on this, and why do we need to expand it?
So let me say first, I don't believe that Beth is in her 50s. There are 2 big problems that relate to this issue. And one is that right now an employer is not allowed to put money into an account that you own and let you choose a primary care doctor that provides all your primary care. You make a monthly payment to the doctor of your choosing. You have his cell phone. You can call him at night and on weekends. We used to call this concierge care, and it used to be really expensive. Now it's called direct primary care, and the prices come way down. And by that I mean, mother with a child, it would cost her $50 a month, child $10 a month, and they get all the care the primary care physician would provide. But at night and on weekends, they don't have to go to the emergency room if they don't really need to. So this is the fastest growing part of the market right now. An employer can pick a doctor and send you to that doctor, but he can't put money into an account and you can choose your own doctor. And if I interpret your bill correctly, Beth, they would be able to do this, I think. And that's huge. It would open up the door. And the other thing has to do with the chronically ill. Because of that high deductible, an employer can't or could not until recently provide free insulin to a diabetic or provide free maintenance drugs for any chronic condition. And it doesn't make sense to have the diabetic not be able to afford the insulin. You show up at the emergency room, you get them into the hospital, the costs become enormous. Now, Trump helped with this with an executive order that had about 12 or 13 conditions where the employer could provide this without your having to meet a high deductible, could provide it for free. But those executive orders, Congress was not involved. The next president can reverse it. So it's not at all permanent, and it needs to be in legislation permanent. And so these accounts then would be far better for the chronically ill. And that's where all our money is going, folks. It's on chronic illness. So if we can make that better, we've made a huge change in the healthcare system.
So to follow up on this, how can we layer things like HSAs, HRAs? How do we turn patients into shoppers? Because right now, patients are like a commodity between providers and their insurance companies. How do we continue to enhance this and build off of it? And this is for both of you.
Well, one way is to empower patients with money. And not everybody wants to manage his own care. I got to say, some people want to be in an HMO and have the HMO make all the decisions. But But a lot of us want to make our own decisions, and we shouldn't be forced to do that. But if we're willing to, if the diabetic is willing to manage more of his own care, we ought to be able to put money into an account so he can do that. And I think that the employers and the third parties, third-party insurers would be willing to do that. What happens is that you want to make the insulin and the drugs free because you want the diabetic to take those, and so that should be at no cost. But the money in the health savings accounts would be there if the patient is not compliant, and the biggest problem with chronic illness, by the way, is non-compliance with drugs. So you don't take your drugs, you get into trouble, you go to the emergency room. That's where the patient needs to be paying out of his health savings account. So he gets the benefits of wise management of his problem, and he bears the cost when he's not prudent.
There's a problem when you're paying one fee every month for unlimited care. You cough, you're going to go see your doctor if you want to. There's a problem with that. So making people more, I think, in control, but also understand that there is a cost for healthcare. Right now, we tend to give the benefits to the employers. How many of you have had a job for more than 10 years? How many have moved? like the average person now is changing jobs every 2 years. I don't want to have to change my health insurance. Okay, you talk about GYN. It doesn't get any more personal than that. Okay, I keep my own car insurance, my own auto insurance, even though I'm changing jobs, right? I could care less what mechanic is working under the hood there. But when I'm talking about a doctor, that's a little bit more personal. I don't want to have to go. He's going, don't go there. I don't want to have to go and change doctor after doctor. You get to know your doctors. You have a relationship with them. Why, as an individual, can I not decide what my insurance is going to be? And if I choose to change employers, I get to keep my health insurance. By empowering patients and not necessary employers, giving them the option, they would get the benefit. They would get the tax incentive, the tax deduction, not just the employer. I think that is one way to go. But also recognizing and aligning, you have X amount of money to spend. You can choose how you're going to spend it, but recognize that every time you go to the doctor, there is a cost. It's not just one charge every month. Responsibility and accountability to truly be in charge. And I like your common sense approach for both of you. It seems like common sense. Why can't they do it in D.C.? So we appreciate your leadership. If you're looking for common sense in D.C., you're going to be searching for a long time. I know. So we need more folks to get on board with this. We need folks from our Texas delegation, more folks across the country to take an interest in this and really drive on. Now, I have to say, the American people agree with both of you. From our polling, Americans for Prosperity has shown that 87% of folks agree with HSAs, that people should have greater access to HSAs. So I want to do a little shift here, and it's about prescription drugs, the cost of prescription drugs. And we may have seen recently in the news that the Inflation Reduction Act, they put price controls in there. I don't know what that has to do with inflation. And I'm just on the line with your district, Congresswoman, but sadly I have Colin Allred, who's been celebrating this, that he can drive down prices of drugs. That seems like a top-down approach. And we're spending $10 billion, 10 years, $3 billion of effort, and consumers, the patients, are paying for government bureaucracy. How do we fix this? Well, it's not driving down the costs at all. What it's doing is it's a shell game. You're going to end up paying more in premiums. You're not affecting the cost at all. It's just that you're making everybody have to pay for it as opposed to those who are actually the users of the specific medication. How do you do it? You open up competition. You allow other drugs to come on the market. A lot of times you've got some of the pharmaceutical companies that will play games. They'll change one little degree within their drug so that they get another 10 years, as opposed to allowing the generics to work faster. Allow competition. Get the prescription benefit plan managers out of the game, because what they originally were brought into has not turned out. It's all about maximizing the revenue for the pharmaceutical companies, and the PBMs are not helping at all. Allowing more competition, allowing if federal dollars have gone into creating the research and development for a drug, then that should not be passed on to the consumer. They've already paid for it once, they shouldn't be paying for it twice.
Excellent. Dr. Goodman, FDA reforms, because I was reading some stuff that you had. Drug companies are kind of gagged. They can't talk about their product. There's First Amendment issues. There's just a bureaucracy like no other. So what kind of reforms could we look at?
What you said is true, but let me first go to what's wrong with Medicare and drugs, and it's a really bad system. As many of you know, if you're in traditional Medicare, you have to pay 3 premiums to 3 plans. And one plan handles drugs, and some other plan is handling your medical expenses, Part A and B. Now, you don't want a setup like that because your drug insurer makes money if the diabetic doesn't buy insulin. That's good. It doesn't have that expense. But when the diabetic goes to the emergency room and gets admitted to the hospital, the other insurer has all those costs. So you have 2 different insurers with opposing economic interests. So that's bad from the get-go. But then we have this crazy rebate system. And it works, I'm just going to give you an example. You go to Walgreens, you need insulin, and the pharmacist says it's going to cost $100. That's the list price. You have a 25% copayment, so you pay $25. What he doesn't tell you is that wasn't really the cost of the insulin. That the drug plan that you're a member of gets a rebate from Eli Lilly, let's say $76, because the real cost from Eli Lilly was only $24. And so your copayment, your 25% copayment should have been $6, not $25, not $24. And so where does all that profit go? Well, it goes in competition, lowering the premiums that people pay for these drug plans. Now, one good thing that Donald Trump did, and let me just say about Trump, I don't think he knew half of what he did in health care. I tried to tell Kellyanne and those folks, Trump ought to go out there and campaign on good things that happen in health care, and he never did. He might have won had he done so. But anyway, one good thing he did is had an executive order saying, we're going to insist that you give that rebate to the patient. You have to pass it on. And one of the things the Democrats did in this bill they just passed is they repealed that rebate. And we're talking about over 10 years, hundreds of millions of dollars, billions of dollars. And so in that one act, remember how they said this lowers the deficit? Lowers the deficit because they're shifting costs to seniors, and the seniors are going to now have to pay more at the pharmacy, except for the catastrophic portion. So this bill was bad for seniors in most cases, and because nobody understands this market, I don't see anybody really campaigning and talking about it. But what happened was bad. And I'll tell you,
it sounded so good. It sounded so good. I keep seeing my social media like, you voted against. It was a horrible bill.
It's just spending, just more spending that doesn't solve the problem.
And it was bad for seniors. You end up paying more in your premiums, and you're not getting the benefit.
And even the CBO said, we expect premiums to rise, which is exactly what's going to happen. So pay more at the pharmacy, higher premiums, bad bill, but it's so complicated, it's hard to campaign an election on an issue like this. But it happened so quick, we weren't really prepared for it.
Sounds like you need a grassroots play. People like Americans for Prosperity
That's exactly
going door to
what
door.
we need.
Yeah. So thinking about, we were just talking about seniors. I want to get to innovation in a second, but I want to remind everybody, if you've got questions, make sure you write down those questions on your cards, and one of our staff members will pick it up. We'll get to the question and answer period here in a second, but for our seniors, we've got seniors, we have children, we have people that are the least among us who need to be protected. How do we mend safety nets and protect people with pre-existing conditions? Because some people will say, free market, well, you just don't like poor people. Now, how are we for everybody when we use the free market?
Well, you allow options. As opposed to the government plan, which is one size fits all, you allow options. So people can pick and choose. You would have an option, with all of those that are on the table of having pre-existing. You would have an option if you want to have a high deductible. But stop making everybody be forced to buy one plan. It does not fit, and it does not work. You're 24, you're starting out, you never go to the doctor. You don't know it, but you still want to be covered, but you are not going to prioritize, double-digit percentages coming out of your paycheck when you don't use it. Again, fast forward to when, I was in my early 30s, my daughter had 9 surgeries. You best believe that when I'm looking for a job, I make sure that they've got health insurance so I can cover it, that it has my doctor on it. That became a priority. But to assume that everybody's got the same priorities, the same needs, and the same pocketbook is ridiculous. It's not realistic.
So, Dr. Goodman, you think about Medicare, Medicaid, how can we improve those? Are there some of these innovations that could fix this and we can mend the safety nets?
Well, let me first go to the question you asked, Beth. There are 2 places in our healthcare system, and only 2, where once a year for about 6 weeks, people get to choose among competing health plans, and their government subsidies, and their private insurers that are competing, and you can't discriminate on the basis of pre-existing conditions. One is what we call Obamacare, and that's about all there is in the individual market. The other is called Medicare Advantage. This one was created by Democrats. This one was created by Republicans. This one over here is a market in which nobody wants a sick person, and so they're trying to attract the healthy and avoid the sick. And that's why you can't go into UT Southwestern or MD Anderson because they don't want sick people who need the expensive specialists and expensive facilities. Now, Medicare Advantage is different. In Medicare Advantage, the plans can specialize in conditions like heart disease and lung disease and diabetes, and they can advertise. And the diabetes plan can say, you can't come in our plan unless you have diabetes. And they get paid an extra premium to take care of these people. And so you have competition in a market to take care of sick people. In Obamacare, that's not allowed. So in Obamacare, you cannot say we're going to specialize in a particular disease and only take those people. Cancer Treatment Center of America, you all probably seen it advertised on TV. It cannot compete, it cannot exist in Obamacare. But it could in Medicare Advantage.
I appreciate that. One last thing I want to ask. We've been hearing more about direct primary care, and that's something that as an organization we're going to be looking at to make that universal at the state level. Will we be able to use HSAs if we improve that system to pay for direct primary care? Will that help us expand that? So if no one knows, direct primary care is a subscription service. Think of Netflix for your doctor, a fee that you pay every month that you see your doctor an unlimited amount of time. So do you see that with the HSA? We should be able to pay for that service.
Yeah, I think Dr. Goodman went into that and kind of already explained it. And yes, the answer to your question is yes and yes.
Perfect. Well, we want to get to that. That makes it easy. James, do you have some questions for us that you could bring up? Or Dr. Goodman, do you have anything to add on innovations, direct primary care, anything else before we go some questions from the audience?
Well, you put your finger on it a little earlier. The market has to be free to innovate and meet people's needs. And people sometimes ask me, can the free market really work in healthcare? And my quick answer is, it's the only thing that works in healthcare. That if you look around at every market where the third-party payers aren't, so show me a market where there's no Blue Cross, no Medicare, no employer, and that's a market that probably works. Cosmetic surgery, LASIK surgery, online rx.com, the walk-in clinics, in the CVS pharmacies, Menin clinics. Wherever the third-party payers weren't involved, we got innovation, meeting people's needs, low cost, high quality. Markets really do work when the third-party payers aren't there.
There's one thing before we get to the questions. I had another one that came up. Price transparency. I was looking back on one of our pop-up banners. Price transparency. A lot of people haven't understood that. A lot of hospitals haven't gone by the rules on this. Can you explain how they can kind of sidestep that? Because are they just paying a fine?
No, here's the deal. Because all of you have third-party insurance that pays the bill, you're not paying the price when you go to a hospital. And since you're not paying the price, hospitals don't compete for your business based on price. And by the way, when they don't compete on price, they don't compete on quality either. So we, as patients, are price insensitive. We have no reason to ask what is the price, and the hospitals don't tell us the price. It's not in their self-interest to give us an upfront price. It's in their self-interest to maximize against third-party reimbursement formulas. And just getting back to innovation for a moment, where is all the innovation in the hospital sector? Well, the most active part of the innovator's job is to figure out how to get more money out of Medicare, how to get more money out of employers. That's what they spend day and night doing. Every day when they wake up in the morning, they're thinking, that's the goal, not how can we better care for patients. So we have a system with really, really perverse incentives, and that's why you don't get to know the price. And again, as I said earlier, if you step outside the third-party payer system, if you go to the international medical tourism, you want to fly to India or down even to the Caribbean and pay dollars out of pocket, then you always know up front what the price is going to be. You get quality indicators. You get, what's our mortality rate, what's our infection rate, what's our readmission rate. All this information is available when you have a real market for hospital care, and we do have it in certain places.
Can you imagine knowing what you're going to pay before you actually go in and get the service? Like getting a menu item of like, this is how much it's going to cost? Because that doesn't exist, because every single plan has a different price. And often, especially when you go to the hospital, it's surprise billing. And that was one of the focuses of, I'm on the Healthy Futures Task Force. So Leader McCarthy kind of divided us all into different task forces dependent on our experience and our interest. We're looking at focusing on doctor-patient relationship, but one of the recommendations overwhelmingly was get rid of the surprise billing. You should be able to know what the cost is, and people should be able to compete and make decisions based on that.
Excellent. Well, it's been a good conversation. We got some questions from the audience as well, and then I'm going to have a couple of you before we're getting close to end time. But this one came up. Employer-paid subsidized insurance is the norm for many working Americans. How can we help average working Americans unlock that to make their own decisions? I think we've answered a little bit of that, but maybe on top of that, how do we educate people? How do we go out there and actually explain to people and sell these ideas? Because I think that's one of the major roadblocks for us.
We talk about it. But again, your insurance is typically tied to your employer. That's just because that's historically the way that it's always been. It doesn't need to just be that. How do people find out about car insurance? How do they find out about homeowners insurance? The more options that they have available to them, the more that will be marketed to. And then the private sector side will rely on that as opposed to relying on the government to provide all of that communication.
It's overwhelming. If anybody's gone to open enrollment and you start looking at those things or you look at the market, it's so much easier when you type in your zip code and the model of your car and start looking for car insurance and people start calling you for quotes. That doesn't happen in healthcare. So, Doctor, what do you think?
Yeah. Donald Trump did something that's very important, and I'm afraid he never fully understood what he did. But he had an executive order, again, Congress not involved, an executive order that said employers are now and this is the law now, employers are now allowed to put money into an account for their employees, and they can choose their own health plan. Or the employer can buy a health plan for them that they own, and they can take with them from job to job and in and out of the market. That's portable insurance, individually owned insurance. Now, under Obama, they hated this idea. And they told the employers, if we catch you doing this, we're going to fine you $100 per employee per day. So Obama brought this practice to a complete halt. It wasn't done very much because the law was very uncertain in this area. Under Obama, the law was very certain you can't do it. Trump comes along and says, oh, yes, you can. But in the election, you never heard that because I don't think Trump understood it. But that was huge. And I don't think most employers realize they can do it, because this was not covered well in the medical in the general media and also in the healthcare media. But that goes back to your question: how do we get the employee more involved in getting the health insurance that they like, that meets their needs, by empowering them?
More options, all the better. So this is for you, doctor, as well. This individual wrote, they totally support the personal option and Medicare Advantage. Could Dr. Goodman make a comment about the HMA versus the HSA per his article in Forbes magazine?
Didn't you tell them that they had to ask easy questions?
Well, we got a few minutes, so you could explain.
All right. This is an innovation by this group down in Houston, and I liked it. I thought it was very neat. And it's outside the insurance system, so they're not regulated. the way a health savings account would be regulated. And you put money into an account and it grows over time. And I won't go into a lot of detail, but it's just a way of accumulating a balance that is there to pay for healthcare needs. And it seems to work very well, and it's a growing business.
Excellent. Congresswoman, this is a great question. How can we support your bills? How do we help you in Congress?
Re-elect. Yeah. I'd say write your congressman, but I'm hoping that would be me. Talking about these things, definitely writing about them. I hear all the time Republicans aren't doing enough. We're not out there. We're not in the forefront. Everybody can complain, and everybody can say this is what the problem is. It becomes a lot more difficult when you're trying to put in writing what would be the legislative solution. Because so often when we think about those legislative bills, they have unintended consequences. You can write something that seems fairly straightforward, but it's a lot more difficult to write it where it's only doing what you want it to do and not affecting a host of other issues and causing a host of other problems. So, support, I'm going to have to fight for support. People writing about it is always helpful. It's always a positive thing, talking to other Congress members about it. But quite honestly, when we're thinking about unwrapping the problems that we see in healthcare, I would urge you to contact as many offices as possible and talk about legitimate, honest-to-God solutions. We have these overwhelming, sweeping bills that are always shooting for the fence. I prefer, that's very difficult because someone will always find a poison pill not to vote for a bill. But if you can fix this and you can get to first base and then you can get to second base, are you making progress? Are you working on the tweaks? Because most people, I know I've seen your poll, right? 70% of people are fairly happy with their insurance, with their coverage. They just want certain tweaks here and there. They don't want a massive overhaul. So help us work on what that would look like. And if you've got those ideas, if you've got issues that you want us to address, contact our office and let us know what those are. But also be willing to work with us in solutions.
Yeah, I think as an organization, Americans for Prosperity, we want to be the solution-based partner. That we can disagree on things, but we need to focus on solutions because you can't always complain. You have to, and an incremental approach really matters, and being respectful, even if you're going to disagree. But these healthcare reforms should be a bipartisan thing that we can work on in Congress. It's something we should be able to do at the state level. I'll tell you, I've worked elections and stuff, and I've gone to doors, and you ask somebody very up front, what do you think about healthcare? Well, they don't really want to talk about it. I said, do you want socialized medicine, or do you want your own decisions? Oh, I want my own decisions. Making things very clear to people. And I think as an organization, our grassroots, you being here tonight, we want to empower you with knowledge from your elected official, with Congresswoman Beth Van Duyne. You had Dr. John Goodman here. He's an expert. We want to pick their minds, know how we can really work together. But after this, there's the ability to go to your neighbors with other events, door knock, phone call, be a digital activist. But right now, what you can do, when this comes back up on the projector, there's a QR code. You can fill this out, and this will send, for the majority of you, will go to the Congresswoman, but maybe some of you are in another congressional district. This is the ammunition sometimes you need for your peers to say, I am hearing from my constituents. We need to make this an issue, and we need to push on this. The same thing, your personal stories, I would imagine when you're in a committee hearing or you're on the floor, stories are powerful because I see the other side use stories all day. And they don't want to pay attention to facts. But when you have the facts and the stories and your constituents behind you, it's powerful because we need to move these reforms forward. We need to start with HSAs. We need to be incremental. And if we can lower the costs, and that allows more people to have access, and we've talked about mending safety nets as well, I think that's going to be powerful in the next Congress. We need to get this done. So, Dr. Goodman, I was just thinking about, from your expertise, what should people be leaving here with tonight? What should they be doing next?
Well, re-elect Beth Van Duyne. That's the most important thing. And then just be aware that there are alternatives to what's going on. They're not being discussed very well. You don't read about them in the Dallas News very often, certainly not in the New York Times. But as we've let you know, there's an alternative way to approach healthcare that liberates markets and liberates individuals, liberates doctors. And the problem with the Democrats in Congress, and I don't want to get too partisan, but their problem is they only know two ways of dealing with the world, and that is you regulate and you spend money. And that's the way they approach drug prices. You know, you order people to do something and you spend money, and they do not understand incentives. And as I tried to explain earlier, the market for drugs for seniors is so screwed up because the incentives are perverse. And just about everything else we've been discussing tonight results from perverse incentives. And people in both parties need to understand if you don't get the incentives right, you're going to get perverse results.
Can folks also sign up for your publications, be on your email list, really get the real news that they need?
You certainly can go to goodmaninstitute.org, and I think we've got some invitations over here for you to come to our event on October 27th. This is our second annual awards dinner. We're going to give an award to Phil Gramm, former senator from Texas, and we'll have two congressmen there. We'll get you in the future at one of these. We have Pete Sessions and Ronnie Jackson. And Ted Cruz is going to do the video introduction.
You got Ronnie, you don't have me?
Yeah, well, I know that was unfair.
We have you here tonight. We're here.
So, sign up. We'd love to have you, and it should be a great event.
Well, make sure you pick up one of those packets. It's great information. Make sure you take our personal option booklet. We have to be the happy warriors, the solution-based people when we walk out of here. Talk about healthcare with your neighbors. You never know. I often bump into people in the grocery store, and I start conversations on the price of barbecue. I love to barbecue, and we talk about meat prices. You won't believe where you can open the door with somebody and have a real conversation and change the trajectory of this country. It starts with those little conversations. We're wrapping up here, but Congresswoman, you've said a lot. It's made a lot of sense to me. I hope it's made sense to people here in the room. What are your parting words for us leaving tonight? You close us out.
Just stay engaged. You know, I think enough cannot be said about being happy warriors. You know, we see that what some of the issues are, but we don't always talk about the solutions. And I know, Thanksgiving is coming up. We're going to have some parting shots, I'm sure, over Thanksgiving turkey, if we can avoid those. But when I say avoid, have the conversation. Just make sure that it's a productive conversation. We have seen so much division. We've seen so much hate and so many just those seeds being sown over the last few years. We probably, amongst Americans, can agree on 80% of issues. It's the 20% that we focus on and we fight about. And to me, when I'm trying to get things negotiated throughout Congress, I would rather work with people based on a project that we can both support as opposed to a personality or a party that we can't. And I would encourage that. Don't be shy about it, but also make sure that it's a productive conversation and that you're representing yourself well. We have an election coming up. It is it's not a game. We're not on sides of the Packers versus the Cowboys. There are some real issues that are important that you all need to think about. And I just encourage everybody to get out there, everybody to get engaged, and everybody to vote. And God love you guys for what you do, because putting more information out and making sure that you are an educated voter, I think is really, really important. And what you're going to read in a tweet is not the same thing as being an educated voter. So do your research.
Thank you so much, and thank you, Doctor. Thank you to everybody being here. This was excellent to have you and all the questions. Thanks again.